Good morning, Mr. Smith. How are you doing today? Doing well? That's great to hear. Can you tell me your first and last name and date of birth? Okay, John Smith, 12/8/1988. Perfect. I'm just going to take a look at your wristband, make sure it is the same. Okay, great. Everything matches. Well, my name's Deanna, and I will be your student nurse today. I'm here to change your central line dressing. What's your central line? Your central line is that big IV that your doctor placed into your chest. It's that tube that goes straight into your heart, and it has that clear bandage on the top. So I'm here to change that bandage, that dressing. It's our hospital policy to change it every 7 days. We just do this to make sure that it's nice and clean and intact and that there's no signs of infection, okay? So I'm gonna go ahead and clean my table, make sure we have a really clean workspace to work with, and then I'll explain a little bit more about the procedure while it dries, okay? All right. So I'm gonna wash my hands and grab some gloves. Okay, I'm gonna clean my table for 30 seconds. And the edges. Make sure the whole thing is really clean. Okay. Okay, now I'm gonna let it dry for 2 minutes. Okay, so I will be taking that bandage off and then cleaning the skin underneath. I'm using a chlorhexidine scrubby, so I'm gonna scrub your skin and then I'm gonna clean the tubing and then I'll replace that little blue bio patch and then apply a fresh dressing. Okay, do you have any questions or concerns? No? Okay, I see that you're wearing a mask. This is a sterile procedure, so we want to make sure it's as aseptic as possible and we reduce the risk of infection. So I ask that you keep your mask on throughout the entire procedure. I will be wearing a mask as well. I'm also going to have you turn your head to the left, away from that site. And these are just precautions to make sure that if you accidentally cough or sneeze, you have some protection against getting that bacteria on the site, okay? Okay. Is it okay if I just move your gown down a little bit so I can take a look? Okay, great. I'm going to break this down. I'm going to keep you as covered as I can though, okay? Okay. It looks good. I'm just going to check the markings on the tubing. Okay, it looks the same as the documentation. And then before we begin, I just wanted to ask if you have any pain right now. No pain, no discomfort or anything? Okay, and if you do feel any discomfort during the procedure, let me know and we can stop and address that before we continue, okay? Okay, can you turn your head on your own or would you like to help me? Would you like me to help you do that? You need some help? Okay, no problem. Just gonna turn your head to the side. Great job, Mr. Smith. Okay, I'm gonna wash my hands and put on some clean gloves. Actually, before I do that, I'm gonna set up my supplies, okay? Okay, so I'll need my dressing change tray, and my bio patch, some extra sterile gloves. Okay, and I'm gonna open my package. Okay, I'm gonna remove what I don't need, so it doesn't look like you need an alcohol swab. I don't see any blood or anything on there. And then I'll take my sterile gloves out to use later. We don't need the mask because you're wearing one and I'm also wearing one. Okay, and I don't need the barrier cream. Okay. So the next thing I'll do is drop my bio patch in there, creating our sterile field here, okay? Okay. All right, now I'm gonna wash my hands again, and I'll put on some clean gloves. Okay, Mr. Smith, are you ready to begin? Okay, so I'm gonna start by removing that, that bandage over the top, okay? So let me know if you have any pain or discomfort. I'm just gonna press here to keep it sturdy, and then I'm gonna work around the edges. It's just really sticky, so you might feel a little bit of pulling. Okay. I'll pull around the edges first. How are you doing, Mr. Smith? Doing well? Okay, great. Okay, we're gonna keep from touching that tubing and try to get that bio patch off as well. Okay. Throw that dressing away, and I'm gonna throw my gloves away and wash my hands. I'm gonna assess this site, okay? Looks like you have no redness, no swelling. There's no signs of infection. I don't see any cracks or leaks. I see that this tubing is clamped. And once again, I'm just gonna check that placement of that tubing, make sure it's the same as the documentation. And yes, it looks great. Okay. Okay, the next thing I'm going to do is set up and put on my sterile gloves for this procedure, okay? So I'm going to open my sterile gloves. I'm going to make sure I only touch the outside 1 inch. Okay, I'm going to put my first glove on, touch the inside of the cuff here. This glove on, and then I'll use this hand to put my other one on. Okay. Okay, I'm going to just adjust my cuffs, and again on the other side. Okay. All right, I'm going to throw this away so I have some room in my workspace. And I'm going to move my tray towards me a little bit. Perfect. Okay, first I'm going to my Tegaderm so that it's easier to apply. Hold it there a little bit. Perfect. My bio patch is facing the right direction, so I don't need to move that at all. Okay. So I'm going to touch your tube with my left hand, which now is contaminated, so I'll only be using my right hand from now on. I'm going to grab this chlorhexidine, and I'm going to scrub in a 2-inch square for 30 seconds. And then I'm going to let it dry for 30 seconds. Okay, now that it's dried for 30 seconds, I'm going to clean up the tubing a few times. And then I can throw this away. Okay, I'm going to go in here and grab the bio patch. Taco method. Okay. And then I'm going to grab my Tegaderm. And we're almost done, Mr. Smith. Are you doing all right? Yep. Okay, I'm going to use my left hand to remove that packaging. Drop it off the side. Great job, Mr. Smith. Let's just angle this so it's nice and comfortable for you. Okay. Okay. I'm going to remove this tape here. Okay, I'm going to make sure there's no bubbles, no gaps. Make sure it's intact. Okay, everything looks good. Now I'm going to label. So I'm going to label with the date, which is 2/3/24, the time 1400, and my initials. I'm just going to label your new bandage so that we know, so we have another form of documentation and can know when to change it again, okay? Okay, I'm just going to take a little piece of tape and I'm going to secure it to your skin. Make a little butterfly here so that it's not touching you. And secure. Okay, I'm going to clean up my workspace. You're welcome to turn your head back towards me. Okay. And go this way. And my gloves. I'll wash my hands one more time. Okay, does that feel okay, Mr. Smith? Okay, is there anything else I can do for you while I'm here? No? Okay, I'm going to go document this dressing change. Thanks, Mr. Smith. Okay, I'm going to document the date and time. I'm going to document the assessment of my site. And I'm going to document that it's the same measurement as the document before. And I will also document that the patient tolerated the procedure quite well. Okay. All right, Mr. Smith, I'm just going to tuck you back in here. All right. Thank you. We'll see you soon.